Hello, my name is Tanya Tomjack. I am a dental hygienist, and today I'm going to demonstrate how to use a periodontal probe with my ergonomic loupes. So before I get started, I want to be sure the patient is in the proper position. I like to put them in a more supine position that helps you stay in a neutral position so that your working distance is correct, because your working distance will be longer than with a traditional loupe. My favorite position to sit in is middle or back position. For me, I feel like I can see all the areas I need to see by also utilizing the patient being able to move their head left to right, or even tipping their chin up if they need to see the areas that I'm looking at. So to start, I will start on this right side. Oops. And I will have the patient turn a little bit to the left, and then I can pull the cheek out so that I can see those posterior areas with my direct vision on the top and the bottom. If I need to use my indirect vision, you can turn your mirror to see that direct distal lingual of number 2 if necessary. Also using indirect vision on that upper left area to access all those posterior areas, and then direct vision on the lower left area. I turn to back position to see the other side. I'll use that indirect vision on the mandibular linguals, using indirect vision just to get behind that distal lingual of 31. And then same thing, direct vision for that lower left. And then I'll kind of turn a little bit back to middle position, have the patient turn all the way to the right, and then pull their cheek out so that I can see that upper left area, and using indirect vision again to get that distal lingual of 15 if necessary. Swinging over to that upper right area, using indirect vision to see all of those posterior teeth. If you're comfortable with it, you can come back to back position to see the anteriors using your indirect and direct vision for the buccal and lingual. Same for the top, indirect with the lingual, and then using your direct vision for the maxillary arch. Otherwise, you can come to front position. I like to turn my knees a little bit more towards the headrest so that I can keep a more neutral position with my waist. If you do need to turn a little bit, if you're bending at your waist, it's not your head and neck, so it can relieve some of that tension. And then utilizing your direct and indirect vision on either arch.